So Huntington's disease, again, is unfortunately a progressive neurodegenerative disease that ultimately is fatal. In this particular case, you don't tend to show symptoms until much later in life. It's usually in about your 30s or 40s if you're a true Huntington patient. And in this case, it's not a lack of a gene that has occurred. It is a expansion of something that's found in you and I. There is something called a tripeptide repeat, or a CAG repeat, that sits inside of one gene called the Huntingtin gene. And if you have a limited number of CAG repeats, you're perfectly healthy. The minute you move over that one border into 46, 47 CAG repeats, you become potentially symptomatic. And at that point, you progress. More repeats, in some ways, the worse it is. In this particular case, you show many motor disorders. It used to be known as Huntington's chorea, and actually what you would see is patients moving around ballistically. Everyone thinks of these large, grandiose movements that would occur in these patients in an uncontrolled manner. But that's not all that happens to these patients. That is part of what happens. Unfortunately, they also get a lot of cognitive, depressive type events that are associated with cortical loss, not just deep structure losses. And this progresses over time as well. And this is actually a big problem for patients. Most of us think of Huntington's and we think just about what we see, the chorea. Really, it isn't. It's about cognition. It's about motor. It's about the combination to the patient. And treating all of that is important.